Hi, this is Dr. Alexander at All Creatures Animal Clinic, and today we're going to talk about how to give sub-Q fluids to a cat. Subcutaneous is what we mean by that. This is an important skill for many different disease processes. GI disease, kidney disease are some of the most common, and we're going to show you how to do that today. When you get your fluids set up, your line goes into the hole. This will look different in different fluid bags sometimes, but you want to have that fully engaged. And you'll end up hanging your fluids up like this. We'll show you, but what really helps when you're giving sub-Q fluids is if you hang it up really high. And I mean like reach it on top of a door or up high in a cabinet or something like that, because gravity will be a really big help for you in terms of speeding up the process, but keeping it comfortable. You're going to want to also change your needle every time you give the sub-Q fluids. The two most common types of needles we use are 18 gauge and 20 gauge. The 18 gauge is actually a little bit bigger of a needle. This will help the fluids flow faster, but is a little bit more ouchy to actually go in the skin with. The 20 gauge needle is a little bit slower, but they don't notice it quite as much when you poke them. So that's just about what your cat tolerates and what you can tolerate, and so you can share with us or with your veterinarian what your preference is. Every time you do fluids, you want to change the needle and put a new one on. So you're going to go ahead and twist the old needle away. You have to make sure first that your line is closed so that the fluids don't come gushing out at you. And then you go ahead and get your new needle and put that on. So you have a fresh, clean needle to work with every time. This is Blue. Blue is going to get some sub-Q fluids today. She doesn't particularly like sub-Q fluids. Blue is one of many cats who would really rather not be here, and she'd really rather not have anything done to her anytime. This is really common, and it is a challenge a lot of times when you're giving fluids. Most cats will tolerate having fluids given to them in most circumstances, but it can be a challenge at times. Things you can use. If you have protective leather gloves, that can be helpful, but they do need to be thick. Not normally necessary, but please keep your safety in mind because cat bites are serious and you want to do everything you can to avoid that. A towel is often a really great tool. Just keeping it around them here or wrapping it around them completely can really help keep you safe, especially if you keep your hands away from their face with the towel at all times. And so that's what we're going to try to do with Blue here. If you're having a really hard time, talk to your vet about ways to make it easier. Get a demonstration, maybe even get some sedation. Many cats benefit greatly from some common sedatives that really make a big difference in being able to give them medication safely, especially when they're in critical periods of time. So we're going to go ahead and see how Blue feels about this here today. I'm going to go ahead and keep my towel as a barrier here. When I give the fluids, I want to grab a little tent of skin. So I grab it and I have a pinch of skin between my fingers, and I can kind of push in here, and it's something that really you have to feel more than see, but I'm sort of pushing in between my fingers and making a little pocket of skin there. So I'm going to go ahead and grab a spot. Anywhere on the back is fine. You can even go over the hips. You're going to have the most success in the scruff area of the neck or along the back, and you can change it up depending on what you need to give. So you go ahead and grab your needle, grab your tent of skin, find your little spot right here, and push the needle all the way in. It doesn't hurt too much because it is sharp. And then just kind of gently hold this so that it's not falling out, and go ahead and open up your fluids. Now, if you've properly put your fluids up high, it should start flowing. You may see some little bubbles go through the line. This is fine. A little bit of air going under the skin is not dangerous. Some common things that are going to happen here. They may wiggle a little bit and the needle may come out and suddenly you're spraying fluids everywhere. That's okay. Just shut it and start over. You may see a little bit of blood come out at the spot where you did the injection. A few drops, not a big deal. Some light pressure or just leaving it alone will usually solve it. So what is going to happen, they will kind of react to this sometimes, but she's doing really well. Like I said, Blue is not a cat that loves this kind of thing happening to her. You'll start to feel a little bubble appear under the skin. Now, if you're only giving a little bit of fluids, it won't be too big, but it can become, you know, like a large hump of fluids that you can really feel moving around. That hump of fluids will absorb into their body over about 12 to 24 hours, but sometimes it'll kind of sink off to the side and go to the side or even the belly of their body. One of the reasons we want to give it over the body and the neck is because if you give it too close to the legs, sometimes it can cause some swelling in the leg. That will be temporary and it'll go away, but it can be a little uncomfortable for them. If you want to look up here, we can tell that our fluids are flowing well because we see the drip, 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 drip. If the drips slow down, all you have to do is adjust your needle position. Sometimes it's just a little micro adjustment, just a little up, a little down, but sometimes you have to take it out and reinsert it somewhere else until you get it right. Obviously, that's not something that they're going to prefer, but given the fluids is the important point. And you're going to look at your measurement up here on the side of the bag. Here we have we're at 800. If you're giving 100, you want to go down to the 900 mark or whatever your goal is. And that's how you tell when you're done. Having the bag hanging evenly is the best way to see that level because you can make the level bigger or smaller by manipulating the bag. So if it's just hanging evenly, that's the best way to measure. Goal, you go ahead and just take your clamp and roll it down so that it's completely stopped. And then if you want to come in here. All right, so then you come in, take the part of the skin where your needle is and pinch that, and then pull straight out and keep that pinched. You may have a tiny little bit of fluid leak out, but that is fine. Keeping it pinched will prevent too much of that from happening. It's okay, Blue. When you put the cap back on, you want to lay the cap flat and insert the needle into the cap so that it's completely on, and then hold by the base to secure it. You can leave that on until you change it next time. All needles need to be properly disposed of inside a hard plastic covering or through your veterinarian.